Today I'm going to talk about the types of treatment for varicose veins. The first group being endovascular heat-based treatments, the second group being an injection technique which includes sclerotherapy and medical grade glue, and the third and final group is the surgical group. Now let's start with the first group, the heat-based or ablation techniques. These were developed in the mid to late 1990s and introduced into Australia in 2005 and 2006. They include endovenous laser ablation and radiofrequency ablation. Both techniques have gradually become the gold standard for the treatment of varicose veins, with many international guidelines recommending them as the first-line treatments. The reason for this is that they are minimally invasive, not requiring surgery or hospital admission, and are performed under local anaesthetic on a walk-in, walk-out basis. What happens with these procedures is that a laser fibre or radiofrequency catheter is inserted directly into the damaged vein and once activated, basically destroys the vein by heating it. This results in fibrosis of the treated vein and apoptosis, which is the body's mechanism of eliminating the damaged vein from our system. Ablation techniques are tolerated very well by patients, and despite varying levels of discomfort in the week following the procedure, most patients can continue with their normal activities and even work. The next group of treatments are the injection techniques. The first one is sclerotherapy, of which there are two types: ultrasound-guided sclerotherapy and direct vision or surface sclerotherapy. Here, a special solution is injected directly into the damaged vein, which damages the vein wall and causes the vein to collapse and harden over. Once again, the body will absorb the treated veins over time. The other group of injections are the medical grade glue treatments. Glue has been used in medicine for over 50 years and has more recently become a widely used vein treatment. It can be injected into the damaged veins by needle or by catheter, and what glue does is that once it's injected directly into the vein, it seals the vein wall immediately, not allowing blood to pass through it. Glued veins are eventually absorbed from the body, but this can take a long time. In the right hands, glue treatments provide a much more definitive outcome for varicose veins that are resistant to other forms of treatment. Finally, we have surgery. Before laser and radiofrequency ablation, surgery was the only available treatment for varicose veins. The most popular surgical procedure is vein stripping, and this is the one that most patients have heard of. Here, the deeper truncal vein, known as the great saphenous vein, is pulled out of the groin using a stripping wire. The main issues with the stripping procedure is that it can be quite painful afterwards, and the rate of recurrence or development of new veins can be quite high. Also, this procedure needs to be done in a hospital under general anaesthetic. There is another form of surgery which is different to stripping and is minimally invasive and used to remove surface veins through small needle hole incisions. This is referred to as ambulatory phlebectomy. Here, the surface veins are crocheted out of the small needle holes under local anaesthetic. Patients find this procedure very acceptable and are able to return to normal activities the next day. It's important to remember that not every case of varicose veins will present with the same vein pathology, and as such, it is imperative that you get properly assessed by a phlebologist or vein specialist to find out the most appropriate treatments for you. I hope this gives you a basic introduction into the different forms of treatment. If you need further information about treatments of veins, please visit our website at veinhealth.com.au.